Got it. Okay. Hello, everyone. Peace and blessings. Welcome to today's webinar in reference to emergency management and Category B funding and working with individuals with disabilities to make sure they receive services and stay in the community during emergency situations. My name is Dara Baldwin. I am the Director of National Policy for the Center for Disability Rights. We are a CIL, a Center for Independent Living, you will hear about throughout the webinar. My center is located in Rochester, New York, but they wanted a DC presence. So I live and work in Washington, DC. I have to say it, DC stay hood, DC stay hood, DC stay hood, wherever I speak. So I wanted to say thank you for joining us. Today we are being hosted by the National Low Income House Coalition, which I am a proud board member. So I'm glad to be here. April, which is the Association for Rural Independent Living, and the Partnerships for Inclusive Disaster Strategies, World Institute on Disabilities, and Roads to Freedom Center for Independent Living of North Central PA. I want to thank all of our partners and our hosts for this wonderful conversation we're about to have. I will be your moderator today, and I want to start off with a brief introduction about disabilities, the ADA, and what that means. A lot of people don't know or understand and know that. In 1876, you had what was called the ugly laws. They are the first laws in the country where that said that people with disabilities cannot be in public spaces. That was in San Francisco, California. And that law trickled throughout the world. There are actually still countries that have that law. Russia is one of them, most of them in Eastern Europe. And what that did was it put people with disabilities inside the homes, right? No education, no being in the public. And then later with the New Deal, FDR, Franklin Delano Roosevelt, the New Deal is racist and ableist. It is racist in the fact, since we're talking about housing, redlining and segregation came from the New Deal. So did the creation of institutions and institutionalizing people with disabilities. So then if you were born with a disability, ugly laws, and go inside institutions. Years later, of course, we won't talk about it, but many people fought to have people with disabilities to have a civil and human right. And that is the ADA, the Americans with Disabilities Act. And many people think of the ADA as an accessible law, meaning doors and ramps have to be wide enough. And it is part of the ADA. That's actually the Architectural Barrier Act, did that in 1968. The ADA, the premise of the ADA is a civil and human right for people with disabilities and community integration. Meaning get them out of those institutions and into the communities. Meaning if they were in the communities, give them the civil and human rights they deserve while they're in the communities. Meaning they have education, employment, housing, all the things that we all need to live and thrive. Transportation, environmental, all of the things that we fight for in social justice is for people with disabilities and community integration. So also in this fight, there was a creation of the Centers for Independent Living, the CILs, which my organization is one, and Jody's is another. And what they do they are non-residential centers where people with disabilities go for services, for fellowship, and for advocacy. In order to fight for your rights, you have to know the laws and you have to keep your voice there. So at a state level, you will have advocacy, which is like in my center, New York, Albany. They fight there. And at a federal level, you will have fights and conversations and movement and change in policy. So just so you can have some background about disabilities and where this comes from, and the fact that we believe all people with disabilities, no matter their disability, can and should live in the community. That also means they go and live with everything that we all live and being part of the community, even if you don't have a disability. Meaning, if there's a pandemic, they're going to go through it with us as well. And in COVID-19, we found out that people with disabilities and people of color, Black, Indigenous people of color, at a higher rate were infected with the disease, with the virus, because of congregate settings, but also because of being in the public. And the fact that the public health system is also racist and ableist. We saw what was called treatment rationing, where it was decided that if you were a person with disability, you were not worth saving. This is illegal and it's against the ADA and community integration. And my wonderful panelists will talk more about that, but that also brought up emergency management. Over the years, we've had many fires and floods and hurricanes and snowstorms and all kinds of things that have happened that cause people to be moved from their housing and go to places of safety that should include disabled people, people with disabilities, and it does not. FEMA, which is the Federal Emergency Management Administration, was created to do that, right? To coordinate this around the country and set up these systems and services so that it would be people would be safe during these emergency management programs. FEMA is located under DHS, which is the Department of Homeland Security, which is a problem for Black, Indigenous people of color because you put it under something of enforcement, which means law enforcement and police are involved, which is also a problem for people who are immigrants or refugees in this country. In FEMA, you also have what's called Category B funding, which is a public assistance program that if programs like a CIL provide emergency services, they can get a reimbursement for their services, about a 75% reimbursement. So what we're going to talk about today is that the FEMA program, Category B, and the options that people should have to stay in the community. Unfortunately, we have seen people with disabilities be put back into institutions or be put into institutions. They never came from one, but because of what happened in Hurricane Maria and some other places, they were placed into institutions. And so, you know, it takes a lot to get someone out of an institution. And we as disability justice, I'm a disability justice advocate, so I come from that space. Black, Indigenous people of color are the center of that, believe that these people should not be sent to institutions. So I'm going to start by introducing our wonderful panel and then ask them if they would each talk about them, tell us their names and what they do in this space and why they're here to talk today. So our first panelist is Marcy Roth, who's the Executive Director of World Institute on Disability. Marcy, let us know about you and what you're doing.
Thank you, Dara. Hi, everybody. I'm Marcy Roth, and as Dara said, I'm with the World Institute on Disability. I want to thank the National Low Income Housing Coalition. You are our comrades, our allies, our buddies, our partners in crime. We share a very strong bond that keeps us all, keeps me feeling as though we in the disability community leadership efforts in disasters are not nearly as alone as we often feel like we are. Very briefly, the process by which people with disabilities are served in disasters is really driven by the Rehabilitation Act of 1973, as well as the Americans with Disabilities Act and the Stafford Act. It's important to understand that every federal dollar, whether it's being spent by the federal government or whether it's being contracted or subcontracted to a state or local government or a private entity or like the Red Cross or some entity that's providing disaster services, every federal dollar must be spent in compliance with physical accessibility, program accessibility, effective communication, equally effective communication accessibility, no exceptions in a disaster. You can't say it's the middle of a disaster, we'll get to this later. There are no waivers. The Department of Justice has been entirely clear about that. When there is a federal declaration of a disaster, a number of things could happen. One of which is there could also be a public health emergency declaration. And with a public health emergency declaration, the Department of Health and Human Services routinely provides blanket waivers to states that allow them to do some things that are probably very helpful, but those blanket waivers allow states to bypass all of the protections that keep people out of institutions and allows for those folks to be institutionalized, not based on their individual needs, but on the needs or the perceived needs of the community. So if you're in a hospital bed in the middle of a pandemic and that hospital perceives that they need your bed for somebody else, they can move you into a long-term congregate facility, regardless of what your needs are, because it's based on their needs. And so despite the fact that there is a long-standing obligation never to waive civil rights protections of people with disabilities, including in disasters, in virtually every public health emergency over the last number of years, there has been strangely the wavering of those protections.
I'm
Yeah.
sorry, real quick. I was asking, could you tell us tell us about the World Institute on Disabilities? And and then we're going to come back and go through all of those questions. But I was first, just tell us about you and the World Institute of Disabilities. Thanks.
Sure. So the World Institute on Disability was founded by three incredible people. Ed Roberts, who is known as the father of the disability rights movement, Judy Heumann, who is known as the mother of the disability rights movement and who is currently being featured as a badass on the Washington Post magazine, and Joan Leon. WID is 37 years old, and we are one of the first global disability rights organizations with a commitment from our founding and throughout all of WID's 37 years to be led by people with disabilities. We work in a number of different areas, but one of the areas we focus on is emergency preparedness, disaster risk reduction, climate justice, and community resilience.
Thanks for that, Marcy. And thank you for your introduction. And we are going to come back to those questions. I just want us to get a grounding of who you are and your organizations. So Priya Penner, please let us know who you are and your organization.
Absolutely. Thank you so much, Dar. And thank you, of course, to the National Low Income Housing Coalition, as well as our partners with April. The partnership is so excited to co-host this webinar, and we're so excited to be here presenting with you all today. My name is Priya Penner. I use she, her pronouns, and I am with the Partnership for Inclusive Disaster Strategies. Today, I am wearing a red cardigan and a pink shirt. I am a brown woman with long curly black hair, and I'm wearing a black over-the-ear headphones. The Partnership for Inclusive Disaster Strategies is one of two disability-led organizations, the only US-based nonprofit that has a focused mission on equal access, disability rights, and full inclusion of people with disabilities, older adults, and people with access and functional needs before, during, and after disasters and emergencies. That's a mouthful. What essentially that means is the partnership focuses on the inclusion and the survival of people with disabilities, especially those who are multiply marginalized. We engage with a whole host of communities, and we're in partnership with a whole host of communities, such as National Low Income Housing Coalition, to essentially share that mission and ensure that disabled people across the globe, but especially in the United States, are able to seek the same services and have the same survival rates as our non-disabled counterparts in before, during, and after disasters. So that's who we are. And once again, we're excited to be here. Thank you.
Thank you, Priya. We're excited to have you. And so the audience knows Priya used the word multi-marginalized. It's a word that a couple of us came up with in reference to disabilities, specifically around Black disabled folks. In the fight, they were pushed and thought to have to pick their marginalization. And you can't ask Black disabled people to do that. And so we come from the space of working on people who have multipleizations, not multiply. You don't multiply them, it's a multiple. So think of an African-American transgender woman who's a refugee, who's formerly incarcerated and disabled. They exist. And all of those marginalizations is what we fight for in our work. So I'm gonna move us forward to Noah Patton from Housing Policy Analyst, Disaster Recovery from the Coalition. Noah, you wanna introduce yourself and talk about the Coalition?
Yeah, thanks, Dara. Yeah, so Noah Patton, Housing Policy Analyst of Disaster Recovery here at NLIHC. Sometimes it's kind of surprising that NLIHC is kind of like operating in the disaster recovery space, but I'd say, of course, it's a logical, a logical step when you consider the future impacts of the future impacts of climate change and the effects of climate change currently, affecting people across the country. So NLIHC leads the Disaster Housing Recovery Coalition, the DHRC, which is a group of more than 850 national, state, and local organizations, including many working directly with disaster impacted communities and with firsthand experience recovering after disasters. So we work primarily to ensure that federal disaster recovery efforts reach all impacted households, including the lowest income seniors, people with disabilities, obviously, families with children, veterans, people experiencing homelessness, and other underserved populations who are often the hardest hit by disasters and have the fewest resources to recover afterwards. During the COVID pandemic, in addition to NLIHC's work on pushing for emergency rental assistance, eviction moratoriums, and a host of additional support for the low-income renters or cost-burdened families and across the country, we've been supporting. Specifically, we've been working towards ensuring that communities and their advocates have the information and the funding that they need to get medically vulnerable folks living in congregate care environments, including congregate care facilities, including homeless shelters, into hotels and other non-congregate sheltering via FEMA Public Assistance Category B, emergency protective measures. And along with that, we've been pushing for greater reimbursement levels, which we achieved in January, thanks to President Biden's executive order bumping the reimbursement up to 100%, and continue to push FEMA to release the levels of guidance, to clarify certain things about the program that would make it easier to deploy across the country as the pandemic continues. So,
thank you for that, Noah. And our next panelist, Jody Bainey. You want to introduce yourself, your title, and tell us about your CIL?
Hi, my name's Jody Bainey. I work for Roads to Freedom Center for Independent Living in Williamsport. I am the director of programs. We have many programs as a CIL, and I'm excited to be here today.
Thank you, Jody. And Justice Shorter from the NDRN, you want to introduce yourself and tell us about your program?
Hey there, everyone. Again, my name is Justice Shorter. I am the National Disaster Protection Advisor at the National Disability Rights Network. Quick image description, I am not on camera, and that's because I have multiple devices going at once. So that is an accessibility need for me in order to keep my notes going. You may also hear me pausing a bit as I speak to listen to my computer in terms of some comments that I've jotted down. As I said, I do work for the National Disability Rights Network, which is essentially the umbrella organization providing technical assistance, training, and support for the 57 federally mandated protection and advocacy agencies for people with disabilities. There is a protection and advocacy agency in every state and in every U.S. territory, as well as one in the Four Corners region of the U.S. that serves Native American populations. There's also one in the District of Columbia. In terms of my work in particular, my entire aim is to support the protection and advocacy system with any issues that might arise around disasters, fires, humanitarian crises, and other types of emergencies, which now includes pandemics. So I enter into this work and I enter into today's conversation in hopes of bringing forth a few of those perspectives as it relates to the Protection and Advocacy Network, since the entire conversation is around Category B, which specifically is around emergency protective measures. And so discerning how the protection and advocacy agencies could play a more integral role and thus be funded consistently to be able to do the work that they are legally responsible for doing is, of course, of utmost importance and a high priority for me as to what I will hopefully be able to share and contribute to today's conversation. The only thing that other thing that I will raise is, as Dara mentioned, I do come to this work with a deep grounding in disability justice. So I will try to marry many of my comments and contributions to some of those disability justice principles around interdependence, intersectionality, collective access, collective liberation, sustainability, et cetera. Dara, back over to you.
Thank you so much for that. And I'm going to ask all panelists, if you're not talking, could you put yourself on mute? That'd be great. Before we move forward, I do want to say thank you to the coalition and all of our groups here for providing ASL interpreters. And thank you to our ASL interpreters. I see you, Cheryl, interpreting, as well as to our closed caption providers. And so people know there is closed captioning and the information is in the chat box, the link to get closed captioning as well as a transcript. And we will be taking questions. So please enter your questions. I see one is there already. We'll get to that as we go along. So please put them in there and I'll be following the chat box for that. We also will be putting information in the chat box for you all to go to, links and things like that for you to have. And when this is over, this will be posted as a recording and you can send it out to your congresspeople and to anyone else you wish to send it to, the White House, and let them know how you feel about this work. So we're going to talk about keeping people with disabilities in the community, right? And trying to resolve these problems in a way in which we do our work. I tell people when I do our work, when you come up with solutions, if you have a homogeneous table, if it's all the same people, your solution is wrong because you didn't have the other voices at that table. If your table does not include people who are directly impacted or have lived experience, your solutions are wrong because they must be at the table to lead this work, not to be a part of the work, to lead the work. And that is what we see going on here. We want to make sure that housing advocates, community development advocates know about this and can work together with disability advocates to make sure and ensure that these types of programs are funded fully to the way they should be and processed and given out the way they should be. And number one, keeping people with disabilities in the community. So I'm going to start with our first question, which we all kind of discussed. You know, why is there a denial of the Category B funds and in your perspective and where you come from this? And Marcy, you hit on this a little bit. I'm going to go backwards on this question and come back that way. So I'm going to go to Justice first and then go back up. Justice.
Hey there, this is Justice. I actually also just realized that I don't even think I gave the image description. I think I talked about why I'm not on camera. So just for accessibility purposes, I am a Black blind lesbian woman. I have flat twists in the front of my hair and 2-strand twists in the back. And I am currently working from my home in Washington, D.C. All right. To Dara, and with regards to your question, I think that it has really been kind of a lack of clarity and forthcoming information around what is needed in order to fully comply with the standards and the eligibility requirements for nonprofit organizations to receive funding through Category B. So that's really been the issue. I think many of us on this panel have been in conversation with FEMA representatives for, quite some time around trying to get more clarity on a national level, because there has been some regional conversations and even some progress on a regional level around making sure that organizations, nonprofits, groups that serve individuals with disabilities could also be reimbursed for their efforts, so for their work, as well as the cost incurred to do that work. However, trying to make sure that those standards and that level of eligibility is consistent and universal across the country has really been difficult to attain. I personally have been trying to seek additional clarity around assuring that protection and advocacy agencies could be reimbursed for the work that they are legally required to do or federally mandated to do around protecting the rights, the life, the safety, the dignity of individuals with disabilities, and being able to do that in a disaster specific context. Often it requires additional hours, it requires the travel to different locations around the state. There is one protection and advocacy agency for every state. Some states have multiple offices, but the capacity for each protection and advocacy agency will vary. Similarly to a Center for Independent Living, the capacity of one CIL may be different than the other, right? So that conversation is very similar, and it parallels when you look at it in relation to protection and advocacy agencies. However, the information has still yet to be forthcoming as to whether or not those activities that are being done, again, to whether it's monitoring and investigating conditions in congregate care settings, whether it's monitoring and investigating situations inside of shelters, whether it be trying to remove people from congregate settings into more safer options for them, whatever the work that is being done. And I'll go through this kind of a little bit more perhaps later on in our discussion, but figuring out if that work could indeed be reimbursed for. And the reason why we say that is because those types of activities, whereas some people may think that this is not really critical, it is absolutely essential and integral for people with disabilities when we talk about life-sustaining and life-saving support, right? So it is the difference perhaps between life and death if you're able to transition from a congregate setting where everybody has been infected with COVID-19 and where there haven't been consistent protective measures in terms of the physical environment and maintaining sanitation and maintaining health protocols. It is absolutely critical for you to get out of that situation and perhaps into an alternative living or housing arrangement, right? And being able to get that assistance, not, in tandem with many disability organizations that are operational. So that includes a CIL, the Protection Advocacy Agency, and other nonprofit disability-centric, disability-led organizations working there on the ground. But if you could receive assistance from these groups with transitioning yourself out of there, that is where I want the conversation to go. And I think that's where all of us are hoping to have additional discussions and where a lot of our advocacy has been poised around. So I will kind of leave it at that. But for me, the real concern has been around a bit of ambiguity and lack of clarity and verification, and then kind of also having that information be quite apparent in any guidance documents and material that's coming out, so that it is clearly verifiable that these types of activities can indeed be reimbursed and covered under Category B funding. So I'll stop there.
All right, thank you. Jody, you're up next. You want to talk about what's happening for your CIL and Category B funding?
We have a disaster relief and relocation program, and we have been working for months to try to get reimbursed back for the services that we did provide individuals. However, we have not been successful. Currently where we're at is it was submitted and we have no further guidance. We don't know if it's been accepted, if it's been denied, if they need further documentation, and no guidance on what to expect going forward. We had many snags along the way with the process. So again, we're just unsure. So we had to use other funding sources for our programs, and we are hopeful that we will be reimbursed.
Okay, thank you for that on the ground, right? She's letting us know what's actually happening. And please, in the chat box, I put a link to the NDRN, National Disability Rights website, where you can find your local P&A. There's a P&A in every state, every territory, and one specifically for Native Americans. Noah, you're up next.
Yeah. So there's a couple. So I mean, from our view, there's a couple issues, and first off, I'd agree with Justice that, you know, the lack of clarity from FEMA is, you know, one of the most major issues kind of facing folks that are seeking to utilize Category B for non-congregate sheltering, you know, and that's been that way since the start of the pandemic. But kind of just starting off from the beginning, I think there's a couple issues that at least we saw. Number one was just the sheer kind of scope of the pandemic writ large. Like, it touched a lot of places that may not have gone through a disaster recovery or emergency response process before. So you were seeing a lot of you know, folks that were unfamiliar with these programs, unfamiliar with the types of options available at like the local and state government levels, as well as kind of on the advocacy side as well. So that just kind of like adds in an additional level of need for clarification and guidance based on that, because people are kind of operating off of rumors, operating off of hearsay and things like that. So with that, I think that really hit us hard kind of initially when we were when we were like, oh, FEMA did this excellent thing and it was approved Category B emergency protective measures for non-congregate sheltering. Like, that's a, you know, and kudos to FEMA for doing that. But at the flip side, you know, we were talking with local advocates on the ground, you know, folks would turn around to their state and local governments and say, hey, well, okay, we can get reimbursed for this. Like, if we can work together to submit all the FEMA public assistance applications, then we'll receive the funding after the fact and go from there. And just the level of pushback that folks received on just the idea of hotel sheltering in general was very substantial. And oftentimes those folks would use the lack of clarity from FEMA as a reason not to move forward. They would use rumors based on like, oh, FEMA never gives out public assistance, or they'll fight us the entire time. We'll never get this money. It's not worth doing. As well as kind of a worry about like, what's the end game, which I think we'll probably talk about later, is like, how do we make this process sustainable and things like that. And, you know, at the time, I think we were kind of like, we'll worry about the end game once like folks are out of like very dangerous environments. So like, we just got to like save folks first, and then we can, you know, have those conversations. So I think it's been a whole struggle of, at least on from NLIHC's view, working, you know, kind of in the homeless service space, is just kind of like, how do we help advocates on the ground that you know, aren't necessarily that familiar with disaster recovery concepts, that don't have those kind of relationships that going through a disaster kind of builds, and B, how do they make the argument in favor of non-congregate sheltering to local and state officials, as well as thread that like that lack of guidance from FEMA. How do you punch through that in order to ensure that you do receive funding and that you can successfully submit the application and receive those reimbursements back? So that's kind of where, yeah, a brief overview, I think, of where we're coming from it. And I think just to add on at the end, obviously, you know, I think that experience has been so much worse for disability justice advocates in terms of when you compare that to homeless services and housing advocates. I don't like to like compare the two, like one's, you know, some folks are, you know, or like some folks like have it good while, you know, others are struggling in obscurity. I think it's an issue, but I think, you know, I think a united front is kind of necessary for that, to push for non-congregate sheltering for both individuals experiencing homelessness and folks living with disabilities that are in congregate, because they're both in congregate care settings. They're both very vulnerable, medically vulnerable. You know, they both need this non-congregate sheltering to stay alive during this pandemic. And I'll stop there.
Thank you, Noah. And you hit on exactly principle number 10 of disability justice, which is collective liberation. Is that when we liberate one, we liberate all, and that we do not pit each other's disadvantages, disenfranchisement, marginalization against one another. And so that's why it's very, we tell people if you center your work in disability justice, you will cover all people. So I'm going to move to Priya, and please, panelists, look at the questions in the chat box. One, I'm just going to answer real quick, is asking about people with non-visible disabilities. So people know the CILs and all of us sitting here, the work we do, even the P&As, are cross disability organizations, which means we assist all disabilities. So if people are blind, low vision, deaf, hard of hearing, physical disabilities, developmental disabilities, mental health, all of those disabilities are included in our work. They also are included in the ADA, the definition, in the ADAA, which was the Amendments Act, done a little later, 2008. It also expanded to HIV and AIDS and other disabilities that are more episodic, as we say, like MS and D, those kinds of things. So I just wanted to put that out there. Next up was Priya to talk about why the denial category B funds are harmful.
Are harmful, absolutely. This is Priya Penner. I mean, I think the other panelists have touched on why it's harmful. I think Justice and Noah really got to the point of this denial of funds is disproportionately impacting people with disabilities and other multiply marginalized individuals. And when I say we, of course, I'm speaking as a multiply marginalized individual. We are being impacted by these denial of funds, by the denial of funds, both with public assistance and category B, but also within individual assistance as well. I think Noah touched upon how there's that increase, given the pandemic, the increase of need for individual assistance and that increase of need given the concurrent disasters, really is that that increase of need given the increase of frequency and intensity of concurrent disasters really is impacting FEMA's ability to process individual assistance applications. Also, it's important to note that they have a very structured way of applying for both public assistance and individual assistance and given that during individuals and organizations are applying for these during disasters, people don't have time to grab a deed to their house when they're literally running for their lives or trying to find accessible accommodations elsewhere. So this specific requirements, of very structured needs from FEMA, et cetera, are really disproportionately impacting multiply marginalized individuals. And we see that with Roads to Freedom. We also see that with a partnership. We see that with a partnership with a CIL in Puerto Rico, Mavi. They are doing amazing work on the ground, but can't get any reimbursement for it because of the frequent denial from FEMA. So I think the effect we're seeing is on multiply marginalized communities. And it's exactly like you're saying, Dara, if we can support multiply marginalized communities first and make sure that they are being served and supported and are thriving during these disasters, then other communities will also be pulled up and liberated as well. Thanks.
Thank you for that, Priya. And Marcy, finally, can you give us an answer on how you feel about why denial category B funds are harmful?
This is Marcy, and I also didn't describe myself in the beginning. I am an older, light-skinned woman with red glasses, COVID, gray, curly hair, wearing a black top, and I have the purple and white globe of the World Institute on Disability behind me. And the denial of Category B emergency protective measures is, I want to take a moment and talk a little bit about what the actual impact of this has been. So it is understood and documented by the Centers for Disease Control and Prevention that 99.4% of people in nursing homes and other long-term care facilities are in fact people with disabilities. You don't go to a nursing home because you're old. You go to a nursing home because you have a disability and your community has failed to make the supports and services that you need to maintain your health, your safety, and your independence available to you. This has been an ongoing crisis for many, many years, and especially for Black, Indigenous, people of color who very disproportionately are institutionalized. We've known that these facilities are dangerous places, and the use, and I will give you a couple of other key statistics. Of that vast majority of people with disabilities in these facilities, 1 in 10 people in the US who is in a facility died from COVID. That's about 200,000 disabled people. 200,000 died in institutions. Most of these facilities have not required their staff to be vaccinated. As we speak, these facilities have less than 50% of their staff vaccinated, and they are 25% understaffed. Over the past 90 days, there have been 70,000 people with COVID admitted to these facilities. So, and in the last week, there have been, I think, 400 or 500 people who have died from COVID in a long-term care facility. So this is not something that's been happening in the past, and the failure of making the public assistance Category B emergency protective measures opportunity for relocation for people with disabilities who would like to relocate to a safer place. The fact that that has been denied despite our consistent efforts beginning in early March of 2020, so almost 14 months ago, we have been calling this denial of access to those Category B resources a genocide because of the massive loss of life of people with disabilities, particularly people who are Black, Indigenous, other people of color.
Thank you for that, Marcy, and grounding us in that, again, where my cell is in New York State, right? We had a falsehood of data, right, done by our own governor, right, who lied about the number of people who were found dead in these facilities. And many of us have been fighting to get people out of all congregate settings. So nursing homes, mental health institutions, the prisons, the jails, the detention centers, the juvenile centers, right? Because that is also where Black, Indigenous people of color are. And just so you have some context as to why most of the people in nursing home, Black, Indigenous people of color, is just because of poverty, And because of, right, the systems we're talking about that do not ensure these people, these communities, education and safety and transportation and housing and healthcare as other groups. Another area which is being researched on at the University of Chicago is around the fact that a lot of Black, mostly Black young men, but of course, this is not a monolith, are victims of violence. And when they become victims, specifically shootings, when they become that and they live, they usually are paraplegics or quads or something happens to them where they can no longer live in the community. So right to housing, we have our AA, affordable, accessible housing. There's not a lot of accessible housing for this community to go to when they heal from the hospital. And the hospital has to send you to someplace safe. I use that in quotes, air quotes for people who cannot see me. And so they send them to nursing homes. And usually inner city, like in this place where Chicago, nursing homes are not in Chicago. They're outside of Chicago. So they don't have family connection. They're not connected to their families. They usually are young. The nursing home has no obligation to educate them. So they will not receive, if they didn't get their high school diploma or they're trying to get a college degree, that won't happen. And they also will not have families because you're not allowed to have a family in a nursing home, right? And so you go for 25 years living in that nursing home, not being what we said, the ADA said, community integration, right? Thriving in the community. And as Marcy so well put it, those places are petri dish for disease. And we know this and we've seen this. And so there are many people fighting on different fronts to get people out of congregate setting, and category B funding could help that. So I want us to talk about that in the community, like what's actually happening. And Jody, that's what you're here for. So tell us what happened over the year. And just so people know, we are not out of a pandemic. This is not over. And so we still are demanding for our people to be released from these nursing homes, these institutions, and these places where people are still dying and still getting COVID. So Jody, tell us about your experience and what's happening on the ground.
Hi, everyone. So about a year ago, we created the Disaster Relief and Relocation Program when locally one of the nursing facilities within our county, I believe there was over 90 consumers at the time who had tested positive. And as the days went on, more and more consumers had tested positive, and unfortunately, a lot of deaths had occurred. So we had started advocating with our county commissioners, asking for some assistance with some funding to be able to relocate these individuals into temporary housing, such as a hotel, and be able to provide them services in the hotel that they would need. We, at that time, got a lot of pushback from our county commissioners saying that it was unsafe, it couldn't be done, that these consumers were in nursing facilities because they needed to be there, and that it could not be done, that we couldn't take them out, this just was unsafe. So we had got a lot of pushback from our county, and we decided to go forward nonetheless. We knew that these individuals needed help and needed out now if they had a chance to survive during the pandemic. We as a CIL, we cover 30 counties roughly for some of our programs, such as nursing home transition. So we had started with our own consumers that we had already currently had enrolled in nursing home transition. And we had a few in different counties that had elected to be a part of our relocation program. What we did was essentially we transitioned them into a hotel room with all the same services and supports that they would had they been in an apartment or returning home. And they were able to stay in the hotel until they transitioned into permanent housing. So whether it was returning back to their own home or we were securing separate housing for them. Services that they got, PAS, so personal attendant services, therapies, home delivered meals, any service that you can think of that you can get either in the facility or in the community was arranged prior to the transition. So that's a little bit about our program. We're still actively every day working. If people call us and they want to relocate, we're still doing it. It does take a lot of work and collaboration with a lot of community partners. You know, we are fortunate in our area to have some Good business owners step up and say, hey, we support this. This should be done. People need out of these nursing facilities if they have a chance of surviving during this pandemic. You know, some of our consumers were in rooms that had 3 other individuals in there, or 6, up to 6 sharing a room in a pandemic. No access to cell phones, no access to a shower, no access to the outside world. So this program is well needed. It's needed across the country in order to save lives. So thank you.
Thank you for that, Jody. And Priya, you want to talk about the partnerships, you know, work that they do on the ground, and any stories and what's happening that you've heard about?
Absolutely. Thank you, Dara. So I had mentioned the a CIL out in Puerto Rico, Mavi. The partnership has been working closely with Mavi to work with them to get, you know, Category B funding, because they're doing very similar stuff to what Roads to Freedom, very necessary stuff to what Roads to Freedom is doing now. A little bit about the situation in Puerto Rico for those who aren't aware. As I'm sure you are aware, Puerto Rico has been hit repeatedly by, you know, hurricanes and huge, quote unquote, huge disasters like that. But what many folks aren't aware of is, you know, the islands are being hit repeatedly and concurrently from disaster after disaster after disaster, from flooding and mudslides to, you know, extreme power outages that affect, you know, 300,000 individuals at a time. And, you know, of course, people with disabilities in Puerto Rico aren't being thought of, aren't being considered during these concurrent disasters. So Mavi is a CIL doing the, you know, work on the ground to support disabled folks, you know, things literally such as making welfare checks and ensuring food gets to people, water gets to people, basic things like durable medical equipment and, you know, disability related supplies, ensuring that we can support Mavi doing that. But there's no reimbursement for that type of work. Like Jody had mentioned, they're doing all of that out of pocket. And, you know, this is life-saving work. This work is literally, you know, checking in on disabled people, ensuring that we stay alive because the government, you know, isn't supporting us in the ways that we need, and is further not supporting us because of these lack of funds. And so, you know, we've been supporting Mavi, and I know the partnership has also been supporting Roads to Freedom in their fight to get Category B funding as well. And like Marcy said, you know, this has been an ongoing fight, not only since the beginning of the pandemic, but of course before that. I'm sure Marcy can go more into detail on that fight, but it's been an ongoing issue that private nonprofits such as CILs have been facing. And it's important to note, of course, that, you know, these private nonprofits, they're, you know, the official language that FEMA uses, have the connections to support disabled people on the ground. Those resources, those connections are there. So the effects that we're talking about that are literally costing disabled people's lives is needless. Those lives are being lost, are they're dying because of the lack of funds that are right there. And it seems like a simple, maybe a simple lack of clarity, or even I would dare say a lack of prioritization on disabled people's lives that's costing thousands, hundreds of thousands of lives. So as far as what the partnership's doing, you know, we're really seeing a lot of what Jody's saying in terms of disabled people at risk of COVID, at risk of other disasters, and just CILs having to step up and communities having to step up because the lack of funding and because of the lack of supports nationally and locally.
Thank you for that, Priya. And I put in the chat some of the articles about the Governor Cuomo's lies around the nursing homes. And Justice, I'm going to bring you in on this. I know you have also a different take on this in the area of criminal justice, which I mentioned just a few minutes ago. But I also just wanted to again to say thank you to our sponsors, the National Low Income House Coalition, April Partnership for Inclusive Disaster Strategies, with the World Institute on Disabilities, and Roads to Freedom Center for Independent Living of North Central PA. Thank you for sponsoring this. Thank you to our ASL interpreters and our caption. And thank you to this coalition staff who's behind the scenes helping us with technology. And please keep those questions going. We've been answering some of them as we go along live, but we will also throw them to our panelists to answer as well. So Justice, you want to talk about this and how it affects your work and bringing in, the P&A's protection, advocacy, civil rights laws around this?
Absolutely. And I just want to make a quick note that I have checked the chat box and I have noted the request for me to slow down a little bit. I listen to my computer and this thing is going a million miles per minute. And sometimes I get competitive and I try to match it, but I will slow it down for accessibility purposes. And just let me know, give me a nudge if you need me to try even harder. As I was mentioning earlier, a lot of what I've been concentrating on, at least around this issue, is around enhancing the protection and advocacy system, their capacity to really protect the rights and safety of dignity of people with disabilities, and to make sure that that legal responsibility that they encompass, that is being able to, that they're able to implement and that they're able to execute those responsibilities throughout all types of disasters and crises, right? And so those protection activities can kind of really center on a lot of different things, many of which I mentioned before, but I do want to kind of bring it back to a couple of other options here, especially as it relates to the compassionate release of individuals in jails and prisons. You had many folks with or many protection and advocacy agencies that became activated around this issue, and have been and continue to be, in hopes of gaining compassionate release for people with disabilities in jails and prisons. And so that's important if we're thinking about folks with disabilities in congregate care locations, right? Yes, we're talking about nursing homes, we're talking about group homes, but we also need to be mindful of the rate at which individuals with disabilities are incarcerated and jailed throughout this country, right? So that's also an area where they've been fairly active. And North Carolina, I'll highlight and spotlight, have been successful in their effort to try to really assist the state with depopulating their jails and prisons as a public health measure, right? So that's an ongoing conversation. There's still also this conversation as well. I'm going to bring this into the fold because it hasn't, been mentioned as much yet. We did mention it at the top when we were talking about DHS, but this is also a concern as we think about children who are in ICE detention centers. Right. So how can we make sure those children with disabilities are also receiving the types of support that they need, that we're also kind of curtailing the spread of the virus as it relates to these children, and that they get whatever resources and services, supports that they need to be successful, and in order to be well in such environments? How can we transition them out of those environments? Right. And so these are questions that folks have been grappling with for quite some time. And those questions don't disappear. They don't fade away during a disaster. If anything, they are only exacerbated even more. There's also this concern around housing discrimination, right? So we know that these eviction moratoriums have been in place in different parts of the country, and there's been a lot of advocacy that's been done around these eviction moratoriums. But in addition to those moratoriums, they have also been paired with a lot of angst and anxiety around rent forgiveness, right? So we have to have two conversations at once. If we're talking about eviction moratoriums, we also have to be talking about rent forgiveness, because without having those two simultaneous discussions, it does put people with disabilities at a significant risk of facing additional discrimination once those moratoriums are lifted, right? If they are now being levied with thousands and thousands of dollars in back rent, and that poses the potential risk of individuals being institutionalized because they can no longer afford to live in their community. So remember what Dara and other panelists have been mentioning before, we're talking about accessible and affordable housing. And I also like to add another A, make sure it's available, that enough housing is available, right? Because sometimes you'll speak to officials and they'll say, well, we have some accessible housing, we have some units, but those, nothing new has become available in years, right? So people are on these very, very long wait lists. So while it may perhaps exist, there may not be enough available for the actual population that lives in that community, that city, that county, that state, right? So all of those are things that we need to think about if we're hoping to keep people out of institutional settings. That's another conversation to be had. I think if this pandemic has shown us anything, it has proven yet again that when it comes to public health, and trying to make sure that we focus on life-saving and life-sustaining activities, that integrated housing is always going to be the primary alternative to institutional settings, right? And the other thing that I'll mention here before I toss back over to Dara is the fact that care is integral to the nation's infrastructure, right? We've noticed this within the new administration that care has been incorporated into the infrastructure bill, and a lot of advocacy have been done for decades in order for that to happen. But I want to connect that to the conversation that we're having right now, because in the March 2001 emergency declaration around COVID and eligibility guidance for Category B, it mentions things like, security and law enforcement. It mentions search and rescue. But there is no mention of care work or care workers, right? Many of whom are women of color. So if we're having conversations about making sure that people can be supported in the most integrated settings possible, we have to also be talking about who are the folks who are supporting them. So that entails a conversation around interdependence, right? And our care networks, our care collectives. But that's also a conversation around care workers and how these individuals are treated, how they're compensated, and how they are included in these conversations moving forward, right? So we want to have a multifaceted discussion about that. And then the last thing that I will mention here is that in order to receive Category B funding, it mentions that you can be a state, you can be a territory, you can be a nonprofit. But what is not included in that is kind of the more informal networks that kind of spring up that provide really, really critical assistance and support. And those are networks such as mutual aid groups or emergency relief funds that neighborhoods put together. And that different communities kind of come together and are able to support one another in that regard. Some of those groups don't operate under a nonprofit banner, right? So being able to make sure that they also have support. We can give examples perhaps later on in our conversation here today about the multitude of ways that these informal networks, these groups, and some of them are more formalized, let me be clear, but to make sure that they also have access to these funds is absolutely imperative, because they are the ones who are driving out to check on people as well. They are the folks who are providing access to food and water and medications. They are the folks who are opening up their homes to support folks when if someone with a disability, if their home has been flooded out, or if it's just no longer habitable for any number of reasons, and there's no other accessible option in the community other than to move dozens of miles away. And that's an issue when we talk about transportation. It's an issue when you talk about support systems. It's an issue when you talk about access to your medical services or whatever else you need in order to live holistically. So all of these things are important. So I'll just stop there, Dara, but that's kind of what I would contribute with respect to your question.
Thank you for that, Justice. And you hit on it just a little bit, but we also have to talk about the connection of DHS, the Department of Homeland Security, to law enforcement. And having law enforcement at these facilities that are set up, and having this conversation and definition of safety being law enforcement. Safety for Black, Indigenous people of color is not law enforcement. This work that we're doing here right now is tied into Black Lives Matter. It's tied into what happened to George Floyd. We cannot separate that. I'm the co-chair of the Transportation Equity Caucus. We are working on a campaign to remove the E of enforcement from transportation. They have a motto: enforcement is the only way. And we need to have these conversations with FEMA, although they are located in an enforcement department, they need to move away from that because, as it was discussed, immigrant children as well as immigrant adults with disabilities are afforded our laws and are protected by our laws. So we have to do that. So I want to move it toward Marcy. Marcy, you want to talk about, I want to move us towards how can we work together as a community to resolve these problems and these, to come up with these solutions, which I know we have because we have so many smart and intelligent people who think outside the box. And we're having a great conversation in the chat box. So please check that out. Benjamin, I'm loving what you're saying there. But Marcy, you talk about this all the time, and you started right with, saying thank you to the coalition for embracing that. I will say, when I came to the coalition, be on the board, they were very open, right, for years. Affordable housing. And I was like, okay, can we add accessible? We need affordable and accessible. We have our AA. And although it took some time, after a couple of, maybe 2-3 years of talking and stuff, we get letters now that have affordable, right? It has it in there. All of our programs are accessible. I said, I can't be on the board if you won't have webinars and telephone conference calls. Before Zoom, we were doing conference calls that aren't accessible to our community, right? I just can't do that. And they were very welcoming. How do we do it, Dara? They asked, and how, what do we do and where do we go? And I want people to know that the housing community has come to a recognition of knowing, right? They have to change as well. And we want to be there with them. So they include us and we include them in this work. It's going to take a collaborative way to do this. So Marcy, because you talk about this, talk about what you think, your vision of, right? And I want all the panelists, I'm gonna start with Marcy, and to think about that. What does that look like to collaboratively work with housing, community development, unhoused, activists to resolve this issue and concerns that we have around people with disability in emergency management?
So thank you, Dara. This is Marcy. So let me just begin. I just want to clarify. Independent living centers are not among the nonprofit organizations that get reimbursement. Unfortunately, under Category B emergency protective measures, there is a list of certain nonprofit organizations, that's how they describe them, certain nonprofit organizations are eligible for reimbursement without having to go through multiple layers. And on that list, most notably, are residential facilities for people with disabilities, also known as institutions, sheltered workshops, and daycare facilities. And they specifically, in the FEMA document that outlines the policies and procedures, it's called the Papa G. In that document, they specifically say residential facilities, sheltered workshops, and daycare facilities for people with autism, Alzheimer's, and muscular dystrophy. There is no direct route by which an independent living center or another disability organization, not just disability-led organizations, disability service providers do not have any mechanism by which they can seek reimbursement from FEMA unless the local government has a standing agreement with that organization. The state government has an agreement in place. And even then, the likelihood that there will be reimbursement is unbelievably small. It happens, I can't give you examples of where it's been successful. And I don't want to speak for Jody, But I know that Roads to Freedom has been trying incredibly hard to navigate the reimbursement process. And as recently as last week, Jody, I'm going to just sort of say this if it's okay. As recently as last week, the paperwork was returned because they erroneously used FEMA, FEMA, rather than PEMA, PEMA, and it needed to go to a PEMA source before it went to a FEMA source. And so rather than just sort of closing the loop, turning the F to a, turning the F to a P, they sent all the paperwork back. And one other point I want to make on this is for reimbursement. This is after you've spent the money to help people to save their lives, after you've put the resources in place to give people an opportunity to maintain their health, their safety, and their independence. Maybe a year down the road, 2 years down the road, who knows how long, you may ultimately be eligible for reimbursement. Most small organizations, and probably many large organizations, don't have the capacity to put out life-saving and life-sustaining assistance with no hope of reimbursement and a projected reimbursement, if there is any, that probably is going to exceed their budget year. So how can we work together? Well, we're doing it, right? I mean, here we all are. A group of us went to Bob Fenton, who was the acting FEMA administrator, National Low Income Housing, and many of the folks who are panelists here and some folks who are joining us today. We collectively went to the acting FEMA administrator and asked for an opportunity to meet with him. 4 times he agreed to meet with us. 4 times he canceled us. Ultimately, he said he would be meeting with groups individually. Of the groups that were part of the request to meet, I believe he met with 1, maybe 2. And then I think he met with 2 or 3 others. We work very closely with the DHS Office for Civil Rights and Civil Liberties. Unlike FEMA, they have worked extremely closely with us. The Partnership for Inclusive Disaster Strategies, PRIA's organization, hosts a daily COVID-19 meeting. We've been attending this meeting since February 28th of 2020. The folks from the Office for Civil Rights and Civil Liberties attend on a very regular basis, as does somebody from the CDC. FEMA does not show up. And our very best efforts to try and bring folks together, the partnership hosted a meeting back in January in which the Office for Civil Rights and Civil Liberties brought together the civil rights offices from across the federal departments. It was a very widely attended meeting. The Civil Rights and Civil Liberties folks had many people in attendance, Department of Justice, several offices from Health and Human Services, HUD, Transportation. It was very widely attended. I believe there were 40 federal civil rights representatives on this call. FEMA was on the agenda. They did not show up. They had 1 person who attended but did not attend as a speaker. And I don't believe we've heard from them since in terms of the discussion around the civil rights obligations that they have to people with disabilities. So we continue to reach out to FEMA. We continue to ask them to work collaboratively with us, we will continue to do that. We are all about outcomes. We are all about saving lives. However, we are not going to wait for them to continue our work, which is why we're here today.
Thank you, Marcy, for that. And people, again, check out the chat box. Noah put in the document that Marcy was discussing about reimbursements. He said page 43 about the nonprofits. So Noah, we haven't heard from you. So talk to us and tell us about the coalition. You talked a little bit about the DHRC. You want to talk more about that and how that is collaborative? 850 organizations, which is, I can't, you know, when this was a seed and just thought of, to see this actually grow to that is astronomical. And I will say, because I have been a part of those meetings and conversations, that is where collective liberation is happening. State, local level, federal level, people are asking questions and answering them. They're being answered by people who are doing the work directly on the ground. And Laura from New Jersey, I'm from Jersey, Jersey girl. I saw your questions. I think Noah answered them, but if the panelists could look at her questions about asking Congress and asking congressional, who is helping us in Congress, if you could put those names in there. I know we have some senators who are doing, and House representative members who are doing, you know, great work, outreach. And there is, so if you don't know, a disability caucus in Congress. It is co-chaired by Representative Langevin, Democrat from Rhode Island, and Representative Don Young, a Republican from Alaska. So that is your disability caucus. If you don't know them, you should, and they do great work. There's about 24 members of House and Senate, Republicans and Democrats. We're one of the few caucuses that's bipartisan on that caucus. So, but Noah, go tell us about the DHRC.
Yeah. Oh, first off, I wanted to do my description. I'm sorry I waited so long to do that. I am a white male wearing a gray sweater, dark brown hair, and dark brown beard with glasses. So in terms of, sorry, I was writing down members of Congress really quickly, so I remember who to give shout outs to. So for the DHRC, yeah, that was so it started after Hurricane Harvey, where we kind of realized that there wasn't kind of a central kind of group that was working on low income housing in the disaster recovery space. And what we started initially just working on one disaster. This was before my time, but we were working on one disaster, and then as additional climate change disasters occurred, we would just add additional groups. And then by this point, we've grown it out to 850 organizations that have decent coverage in terms of where disasters are likely to hit. But of course, as we know, with climate change, disasters will hit in additional places that they normally don't. I think like Iowa, the Iowa derecho of last year is a good example of that. But basically what the DHRC allows is not only all of these groups that are working on disaster recovery issues at all different various stages of government is to come together for a unified voice in terms of advocacy, but it also allows us to talk with the work that everybody's doing on the ground to kind of field advocacy ideas, to identify programmatic issues across disaster areas. Because when I talk with folks that may not be familiar with the DHRC or that are newly working on disaster issues, it often feels like you're the only person experiencing, the dysfunction of the American, recovery system, and you're kind of siloed off, and you're like, oh, like I can't believe that these, I have to fill out all these applications, I have to help my clients fill out all these applications to get assistance and things like that. And then kind of as you talk to people that have done the same thing, but in maybe across the country, you kind of start to realize that, oh, the issue isn't just like my one FEMA contact in my, in my area. This is like a programmatic wide issue, and it's built out like that because of, the legacy of inequity and inequality and the fact that disaster recovery isn't it doesn't acknowledge or integrate any sort of anti-racist, pro-disability like thought into its mindset. It's built around denying, how do we deny as many people as possible assistance, to make sure that we don't by mistake give one individual aid that they might, that we, in our opinion, we think that person does not need. So it's kind of it allows that macro view while also keeping going that that on the ground view that's so important to inform these advocacy efforts. And in addition, it allows info sharing across disaster areas. Like, for instance, Priya, I think you had mentioned title documents before. For FEMA individual assistance, you're required to provide title documentation to FEMA. But for many folks, living in manufactured homes, living in indigenous communities, living in Black and brown communities across the American South, as well as Puerto Rico, folks don't have title documentation. And so FEMA will constantly make the mistake of going into an area that, where people don't have written leases or don't have entitlement documentation and requiring it, and subsequently denying all of those folks. But in some areas, I think had started out in Texas, it was used out in California as well. There's this self-declaration form, which allows an individual to attest under penalty of perjury that they own their own home for the purposes of establishing FEMA assistance. And that was developed in Texas, then redeveloped in Puerto Rico and utilized out in California. And that was like a best practice that was shared in between all those things, and then kind of has been used kind of throughout the DHRC and disseminated through the DHRC as a good idea. And, that's just kind of one example of that kind of cross disaster solutions where, folks have been, because folks are struggling, because these are programmatic issues and folks are struggling with them everywhere, there's unique solutions out there. So that's why I think having a good connection between like housers and disability justice advocates and, advocates in communities of color, advocates and organizers in communities of color, like that's how we get it, because we're all working on different aspects of the same solution. So we're coming up with solutions that may be applicable in new ways. So it's important to tie those together. And, in terms of Congress, in terms of our advocacy and how this affects, specifically like on that title bill last week, this Housing Survivors of Major Disasters Act was introduced, which would mandate that FEMA utilize that title documentation form, across the country. And that's sponsored by Representative Espaillat and Senator Warren and Resident Commissioner Gonzalez Colon from Puerto Rico. But additionally, just shouting out like the chairman of the Transportation and Infrastructure Committee, DeFazio, is always a solid advocate and had actually pushed for 100% reimbursement prior to Biden's executive order bumping it up there. But also, Al Green out of Texas, Senator Young, Senator Schatz has been doing some excellent work in terms of disaster recovery and climate change impacts and things like that. So, just a shout out to all those partners. They're there. And I think by unifying our voice and putting it towards those policymakers, that's, how we get some movement, seeing as how FEMA, is increasingly obstinate in the last several years. And I'll shut up now, Dara.
No, thank you for that. So we got about 7 minutes. I want to go around to each panelist real quick and just tell us, real quick minute, your thoughts about the future. And some of those members that Noah mentioned, Mr. Espaillat is a Democrat from New York. Senator Warren is a Democrat from Massachusetts. Chairman DeFazio is the chairman of the and I, Transportation and Infrastructure, in the House Committee. He is from Oregon, Democrat from Oregon. Senator Schatz is a Democrat from Hawaii. I like to say that to people around the country. We here in DC know who they are, policy wonks, but a lot of people don't. And we'll put that on the resource sheet. And there's 2 questions that haven't been answered. If the experts could look at those questions real quick, that'd be great. I'm gonna go again backwards. And so hit Justice real quick. Any last words to the community?
Absolutely. First off, thank you to everyone for joining and all of the wonderful conversations that have been had here today. I'm going to end by saying that I am a book nerd, so I'm just going to throw out some recommendations here because we've been saying the phrase disability justice quite often, and that differs from disability rights. They're sometimes used interchangeably, but they are not the same thing. So if you're interested in additional reading, I would highly recommend Care Work, Dreaming Disability Justice, and that's by Leah Lakshmi Peepsna Samarasinha. I would also recommend Medicine Stories by Aurora Levins Morales, as well as Skin, Tooth, Bone, which is a disability justice primer, and that's by Sins Invalid, which is the group responsible and behind everything we currently know in its current iteration of disability justice or as disability justice. I'll close out by saying that, FEMA's public assistance program in general really focuses on debris removal, life-saving emergency protections, as well as restoring public infrastructure. I'm really curious about this conversation around restoration. So I want us to, as we move into the future, shift from restoration and go towards transformation so that we are not restoring back to pre-disaster standards that were insufficient to begin with, right? So we didn't have the housing to begin with, didn't have the right supports, didn't have the right resources to begin with. So we don't want to go back to those pre-disaster standards, which is sometimes where restoration discussions can land us. We are hoping to kind of move towards this more transformative discussion around what was done during disasters that can be sustained. Right? What are some of the opportunities? What are some of the things that happen that have been really beneficial? And also, what are some of the glaring gaps and omissions, and how can we close those? So those are the conversations that I'm more interested in having as we move forward. And of course, wanting to make sure that we continue to talk about shoring up home and community-based services, as well as tethering this to the integral involvement of care workers, again, many of whom are women of color. So I will stop there and being mindful of time. And my other panelists, it's been a pleasure to be in conversation and community with all of you today. Thanks so much.
Thank you, Justice. And please send me those books so we can put them on the resource sheet. I think I have a couple of them, but just in case. So next up is going to be Jody. You want to tell us any parting words? And thank you for being with us.
I just wanted to add that we are happy here at Roads to Freedom to share any information about our program, how we got started, what has worked, what hasn't worked. If anybody is interested, I will put my email in the chat and you're welcome to reach out to me, and we're happy to assist any way that we can. And thank you all.
Thank you for that, Jody. And I have put my email address in there as well. I'm going to skip because we just heard from you. Priya, you want to go next?
Absolutely. Thank you, Dara. Just my last remarks, would be to once again thank Marcy for that clarification. I clearly misspoke, and that was important to clarify. So thank you, Marcy. And simply there's this lingering question of how can we do this work? How can we ensure that multiply marginalized individuals are getting the resources they need? And I think there's a lot that FEMA can do, and we've discussed, Marcy especially discussed those barriers, but I think on our ends as organizers, it's really, once again, so important to really center the individuals most impacted by disasters, most impacted by these structures in these systems. We've said it in the beginning, we said it in the middle, and I'm going to say here at the end, we cannot liberate people with disabilities, multiply marginalized individuals, until we are looking at everybody. We're looking at all of us who are oppressed by these systems. And again, going right back to those principles of disability justice that Sins Invalid created and working on for us. So those would be my last thoughts. If anyone would like to join the partnership, our daily conversations happen at 6 p.m. Every single day, including weekends and holidays. And you can feel free to email me. I'll be putting that in the chat. But for folks who can't access chat, my email is p.penner at disasterstrategies.org. Again, that's p.penner, Penner, at disasterstrategies.org. Thanks.
Thank you, Priya. Marcy, you're up next. Go, Marcy.
This is Marcy. So bottom line is people are dying with COVID today in nursing homes in which there are independent living center folks who are ready, willing, and able to assist them to relocate. Today, we still do not have the ability, working with FEMA, to get those folks to safety. That's today. And let me be clear, we all know that the pandemic is not over. And for those of us with compromised immune systems, it's not a safe world out there. For children, it's not a safe world out there. If you get COVID and you don't have the support that you need to go back home because COVID has made you that sick, you too are headed to a nursing home. That's where you're going. 70,000 people have been admitted to nursing homes because they have COVID in the last 90 days. So, you know, we can keep admiring this problem. Institutions, whether they're carceral facilities, whether they're medical or hospital facilities, we know that it doesn't work. Congregate settings are not places for human beings to get their needs met. Period. Hard stop. We can continue to dance around it, or we can come together, tear down the walls, shut the front door, and get about the business of supporting people to have dignity and real equity in the things that so many other people enjoy on a daily basis. And this is not about those people. If you live long enough, you too will acquire a disability. It's just kind of how it works. So.
Thank you, Marcy, for those words. Noah, real quick, anything you want to add?
No, I just wanted to thank all of y'all for your expertise and your kindness and your willingness to allow NLIHC to be part of this conversation. You know, I'm looking forward to working with y'all as we continue to confront this problem head on and, you know, in the months ahead. So thanks so much.
Yeah, thank you so much again. Thank you to our host, National Low Income House Coalition, April, Partnership for Inclusive Disaster Strategies, with the World Institute on Disabilities, and the Roads to Freedom Center for Independent Living of North Central Pennsylvania. Thank you again to our ASL interpreters, our closed caption provider, and to the coalition staff, and to all of you who have stayed and joined us. We know we see some questions in there. We will continue to answer them. Again, there'll be a resource sheet put up with this recording. And thank you to my wonderful panelists. It's so good to see some of you I haven't seen in many months. Please keep up the good work. And as you know, we all say, power to the people, all power to the people.